Hello everybody, my name is Dr. Alan. I'm the Medical Director for Diamond Skincare. I'm going to run through today a little bit about how to check your mole for skin cancer. There's a very popular system out there called the ABCD rule. A stands for asymmetry, so have a look at your mole and ask yourself, is it perfectly symmetrical around two axes, or is it asymmetrical along at least one axis? That's the first point you're looking for. The second point, look at the borders of your mole. Are the borders quite smooth? Or is it quite jagged? Even if it's completely symmetrical, if the borders are jagged, it may be something that you need to have looked at. The third thing you want to look for is the color the same throughout, and this can be anything from light brown to dark brown as long as it's the same color throughout the mole. Or is one side, one part of the mole, much darker, almost black, compared to the rest of the mole. The last thing you look for is your mole more than 6 millimeters. Now this is a nice conventional system which lets you diagnose whether a mole you have may be melanoma, but by the time you see these changes, this is not an early melanoma anymore, this is relatively advanced. When you're looking for a melanoma that's just started, obviously remember it will start at less than 6 millimeters, well before it has become asymmetrical. It may be perfectly symmetrical when it's small. The irregularity doesn't show until quite late, and the color distinction doesn't show quite late. We use a special instrument called a dermatoscope, which allows us to look at the very, very early changes well before any of these are established, and that's what we use for early detection.